What do you think? Should I get a chin implant done?
Who, you? Chin
Yeah.
implant? Really? No, yaar. Your chin looks fine. It looks perfect to me, frankly. It suits your face.
Come on, I think you can be a little more frank.
Really? You want me to be really frank?
Mm-hmm.
Okay. First of all, yeah, I would, like to do a little bit of liposuction here, maybe to just get this double chin a little flattened out. Then there are these little jowls over here, which we can, use a little face tight to tighten the skin and the soft tissues here. Then a little bit of filler over here, to make your jawline look a little more prominent. And let me guess, a little bit of maybe Botox over here, so that the angles of your mouth, don't go down and they come up. That will make you look more, what I can say, aesthetically pleasing.
We'll see about it after the session. So, can you explain what you really mean by all the things that you said just now?
Sure, definitely. I'll tell you in a nutshell, how this all goes. First and foremost, yeah, you don't need a chin implant, that's fine. But this region needs a little bit of liposuction. Now, we can also add a little bit of face tight here to make your jowls, recede a bit and make it all look nice. Your jawline will be sharper. Your neck will be even sharper. Your chin to neck, that angle will be restored. Secondly, we can make your jawline a little more prominent by adding some fillers over here. Okay. And one more thing, what I noticed is your gummy smile. When you start smiling, you do get a gummy smile. So we can do a little bit of Botox to make the upper lip go down so that when you smile, it looks aesthetically pleasing. And what I can do is also the angles of your mouth sometimes do go down a little bit. So we can add a little bit of filler and a little bit of Botox over there to make the angles go up a little bit so that, it all looks nice.
Yeah, you said a lot of procedures like liposuction on the chin, Botox, fillers. So, how do you do all this? Is it going to be all together or is it like breakdown into different procedures?
Yeah, so usually speaking, Botox and fillers we can combine, and even this face tight and all, we can all combine it in one session. Should not be an issue. Usually these are daycare jobs, like morning admission, evening discharge. You don't need an overnight stay. You'll be back in business really soon. You'll have some swelling over here, of course, for about a week or two, but it comes down very quickly. That's mainly because of the face tight and the lipo. Okay, for getting a better jawline. But fillers here, Botox here and all, it's just lunchtime procedure. It's quick in, quick out, no downtime, absolutely. And that's it. It's very quick.
So, if you're doing a liposuction, will it leave any marks?
No. Liposuction luckily can be done through, small keyholes or really small incisions, at hidden sites like behind your ear, over here in the chin area. So we make these entry portals such that, nobody can notice them. A layman cannot find them out. And then you do lipo from there and you get your result and everything's hidden.
Okay, now these are daycare procedures you were saying. So,
Yes.
what kind of anesthesia is used here? Is it like topical, local?
Yeah. So for Botox and fillers, we do use topical anesthesia. We just numb your skin and we go inside. Whereas for lipo, I generally prefer a short general anesthesia or a sedation, so that I wouldn't call it an office procedure, but you need an operation theater for this, so that sterility is maintained, your safety is guaranteed, and you don't have any pain mainly. So it's a very clean, neat procedure.
You talked about this face tight. What do you mean by face tight? What is used here?
So face tight basically involves the usage of a machine which delivers radio frequency energy to tighten the skin and the subcute basically. So you make these small entry portals like incisions, okay? And you use face tight to tighten the skin, and you do a little bit of lipo to take out the fat. We don't take out too much fat because your skin shouldn't look skeletonized. You need that youthful look. So that's why face tight and all these kind of devices, which are either radio frequency based or there are other technologies also. But these devices usually give you a good tightness to your skin, and that makes you look more youthful.
So, how does it really work? Is it like creating new skin tissue over there, or
Yes, good question. So basically it improves the collagen synthesis in the skin, dermis, in the subcute and all. And as you know, collagen are the building blocks of the, subcute and all. So that helps in tightening of the skin.
Okay, so
Yes.
along with this, do you recommend supplementing collagen as well? Like any supplement?
Yeah,
do
you can. Oral collagen supplementation is also a good idea to continue with this.
So it helps
And
along with the procedures that you're doing.
yes, yes, definitely it does. Some skin, some skin therapies also can be done along with this. Sometimes lasers help externally. We have even Morpheus, which is external radio frequency.
Okay.
So that can be added to this. I usually do that because some people, they want the OG curve and all, to be very prominent. So we do selective Morpheus. We leave the fat here, remove the fat here, and things like that. So that tightens the skin also selectively, and you get a more desirable result, I would say.
Okay. And I've heard you talking about these threads. So which patients do you recommend threads and which patients can, just go with liposuction and fillers?
Yeah, so threads are usually for the younger individuals with an already tighter skin. The skin is not sagging much, but there is a subtle sag to the skin in the subcute. Usually say the 30, 35-year-olds. So in them usually thread lifts work. I do not use them for more than 40 age group because then there's a more sag which cannot be dealt with just threads.
Okay. And what about facelift? When you say a facelift, how it
Yes.
is different from threads or,
That's a full-on invasive surgery. That's a major surgery. So we usually reserve that for somebody, say, above 40, 45, because each one ages differently. So usually above 45, you get deflation of the face, the fat goes down basically, and the whole face sags, the ligaments sag, everything sags. So, that is the time when we go in for a full-on facelift, neck lift, everything gets lifted at that.